So today I will be discussing my internship experience with Los Alamitos Medical Center. So the onboarding process in order for me to enter with Los Alamitos Medical Center was actually very easy and fast. I did look for this internship myself. So before that, I had to contact educational department and inform them that if by any chance they had a contract with CSULB. So when they told me that yes, that they were able to accept interns from Cal State Long Beach, I was very happy because I wanted to do an internship in a hospital site. So I was called in for an interview. After my interview, they informed me that they wanted me to enter with them. So I had to conduct a background check. After my background check came out clear, I was called in to complete an orientation that took 2 days, along with an orientation packet. So I was placed in the case management department where I learned the discharge coordinator's daily responsibilities. So what I learned was that discharge coordinators need to check their emails for their daily assignment, which is patient information that include patient's room number, their name, their insurance, there's any preferable skilled nursing facility that they want to get transferred to. They also have to print out the list of RN extensions for the day because all day long they're communicating patient's information. I also learned what the discharge temporal criteria is. So the discharge temporal criteria is a criteria that case manager RN follow where they pass on important patient information regarding their health status. So for example, they use three colors, which is green, yellow, and red. So green means that patient is ready to discharge. It also could mean that a discharge order has been placed to get a patient discharged. You cannot discharge a patient without having a discharge order. So when they're getting to get discharged, they're either going to a skilled nursing facility or to a home health no needs. When a patient is yellow, that means that they're either still recovering or they're not very ill, which they can possibly turn into green and get discharged within the same day or within a couple of hours. Red means that patients will stay there for more than 10 days. So the case manager department along with the discharge coordinator. So this department works, well, actually the discharge coordinator position works under the direction of RN case management or social workers to complete referrals for post-acute services for patients. The responsibilities include the following: arrange post-discharge services, either to home health no needs or to skilled nurse facilities. They also have to create and follow up on electronic referrals using the tenant case management system, which is all scripts. They also have to review patient choice letters with patients. And if a patient is not, it's not orientated or it's able to speak or has hearing problems, then they have to contact their family members and let them know that in their chart, this patient not let them know, but their insurance is covering this skilled nursing facility. And if they're okay for them to get transferred to that specific skilled nursing facility, then they will need a signature from them stating that it's okay for their family member to get arranged a transportation to that skilled nursing facility. They also have to provide follow-up on important messages to Medicare patients prior to discharge. I was also supporting the social services department since they were short staffed. So in that department, I was answering calls, taking down messages, faxing papers, transferring calls to the right department, printing out any necessary document that the social services need, social workers need. I was also taking down clothes, other necessities to patients without housing. Some of the skills that I was able to learn throughout my internship experience were how to use Cerner, send referrals through all scripts, complete skilled nursing facility package. So a skilled nursing facility packet includes the face sheet of the patient, physical progress notes, physical therapy progress notes, medication, any lab work, because they do want to see what's wrong with the patient. So it's basically any medical history regarding a patient. I also learned what an IM and PCS form. So an IM is a form that medical recipients need to sign, and I was able to walk into patients' room and inform them that since they were medical recipients that they had patients, right? So I had to tell them that I needed a signature, and I had to let them know that if they understood why they were signing this paper. I also learned medical abbreviation such as DME, which is dermal medical equipment. I also learned how to follow up on referrals through all scripts or through phone. So something that I was contributing to the organization was taking initiative, being productive all the time, and most importantly, being an active listener. Some of the takeaway that I will take away from this experience is that discharge coordinators have a tremendous responsibilities for protecting patients' health and well-being by devising personalized recovery plans after treatment. I also learned that they handle the processing of discharge papers and forward them to appropriate clinicals. I also learned that I wanna work in the clinical side of healthcare. So I'm so grateful for this clinical experience. So some opportunities for improvement, are that I need to improve my effective communication skills, which is verbal and written, which is very important in the healthcare. I also need to improve people skills. Although that I am a people person, it's not the same as having people skills. I also need to improve stress management since sometimes this department can be very hectic. There's days that are very smooth. So my future goals will be to apply for a discharge coordinator position at my internship site since they are in high demand. I would do this in order to get experience in the case management department. I also want to improve networking skills, develop communication skills, and explore other departments to see if there's anything else that interests me. Thank you for watching.